Hi everyone, my name is Hildenbrand. I'm one of the vets here at West Village Veterinary Hospital. We're going to talk about preventatives for heartworm, internal, external parasite preventatives. You just hear them as preventatives when you go to your vet, and so there's a couple of different types that exist. Our main categories are heartworm and intestinal parasite preventative, and then flea and tick preventative, so external parasites. And then we have these fun little guys in the middle that are basically combinations of everything. Internal parasite preventative, so heartworm and intestinal parasites are important for in the city. The dogs are everywhere, you're walking on the streets, everybody's pooping, everybody's licking their feet after they go on a walk. You're at dog parks, you're at daycare, everybody's palling around, mostly dogs obviously. But the preventatives that we have here are good for preventing internal parasite problems, so hookworms, roundworms, whipworms, things like that. So they get a little deworming once a month to get those, take care of any parasites they could have picked up from running around the city. Most importantly is that it protects against heartworm disease. So heartworm disease is not something they're going to pick up on the poop. It's basically worms in the bloodstream. So you've got adult heartworms. If you have a dog infected with heartworm, you've got adult worms, and they're spitting little babies out into the bloodstream. You need a mosquito, so mosquitoes will come and bite a heartworm positive dog, suck up their blood, fly around, bite another dog, and when it's sucking up blood from that dog, it'll push little baby heartworms into that dog. And so these preventatives are designed so that the babies that might get deposited into a dog via the mosquito, they prevent them from growing into adults. So we don't have a lot of heartworm risk up here in New York City because we don't have a lot of heartworm positive dogs as the reservoir. We don't have a lot of mosquitoes because they're in warm, wet climates, so like the southern US, so Texas, Florida, Louisiana, places like that. However, the risk is never zero. Our pets go all over the place. You're traveling, you want to take them to Florida and have a little sunny weekend, you want to take them with you when you go on vacation, and so they could have increased risk there. So keeping them on preventative is really important so that when you're going on vacation, you don't have to worry about putting your dogs at risk. There's also dogs that are coming up, they go on vacation, they come back to the city, maybe they're exposed to heartworm, and you don't know, mosquitoes are everywhere. All I know is that I find them in my apartment. It'll be February, there's a mosquito in there, which makes no sense. But if you keep them on the preventative, you don't have to worry that they're going to potentially be infected. So extra bonus, heartworm very important. Even though it's low risk here, it's a really nasty disease if they get it. It takes a lot of work to treat it. It can be a really uncomfortable and painful treatment. So just give them a preventative every month. They're not going to get the heartworm. They've got parasite preventative. It's all good. Flea and tick preventative, usually people know if they're going to be taking them to tick-borne areas. A lot of times, the summer times, everyone's going upstate hiking and camping, they're going to the Hamptons, you're going to Fire Island. A tick bites your dog, and when it's, again, take a little blood sample, it's going to potentially put more diseases, so Lyme, Ehrlichia, Anaplasma, things like that. Those are the things that we screen for at our annuals, and we kind of do a little bit of blood work and look to see if they've had any infected tick-borne diseases. These preventatives will prevent if a tick bites your dog, it's going to suck up the preventative, kind of go away, and it's not going to have that ability to transmit the infection into your dog. These are also important because even if you don't leave the city, again, other dogs leave the city, they might bring ticks back with them, and then they're hanging out at the dog park, they're seeing each other, there's potential for those ticks to kind of get on them. Diseases like Lyme, Ehrlichia, Anaplasma, that can cause problems in your dog, and it's not always obvious. Sometimes these are diseases that they'll just come up on a blood screen, which is why it's really important for us to check them every year. If we get a blood screen and we see that they've had it on there, they've been exposed, we can treat it. Usually it's a round of antibiotics, and we talk to owners about if there's any increased risks there. But it's nice to just prevent it so they don't have to worry about it, and then just kind of keep them on it. Like everything, we like to keep them on it every month, all year round, because the weather's crazy, it's all over the place. We have 70-degree days in February. It's really hard to know that if ticks are going to be out, if mosquitoes are going to be out. You just want to make sure that if you just keep them on it every single month, you don't have to worry about it. Just set it and forget it. Some of these products in the middle here are combinations of these two. So you've got heartworm and intestinal parasites by themselves. You've got flea and tick by themselves. There are some products now. Simparica Trio is really popular with our patients, our dog patients. Revolution Plus is for the cats. But this one is these all in one, so it covers everything. One chew once a month, just put it on autopilot, and then you don't have to worry about it. They come in other various formulas too, so these are chewable heartworm preventatives. This is a topical heartworm preventative, so for those dogs, like maybe they have a sensitive stomach and they would do better with something that goes on their back, there's that. Same thing with the flea and ticks. You've got topical flea and tick. A lot of people, it's the OG front lines. You're kind of used to that. Oral flea and tick, some of them will go once a month. Some of them are every 8 to 12 weeks, depending on your exposure. So there's a lot of options, a lot of varieties. If your dog doesn't do well with one type, you can always try to switch to a different type, whether it be a different brand, topical versus an oral. There's a lot of different options. And long story short, we advocate for preventatives just to kind of prevent any kind of illnesses in our dogs and cats, because you want them to be healthy, you want them to be happy, and they're going outside and they're bringing stuff into your house. You want to make sure you're protecting yourself, you're protecting your pets, you're protecting your family. So if you have any questions, you can always call, talk to your vet, bring them in. We come in for your annuals. We'll talk about preventatives anyway, but otherwise, hope you guys learned a little something. Let us know if you have questions, and stay safe out there.